The new coronavirus outbreak is caused by a virus called SARS coronavirus 2, and it causes a respiratory syndrome disease called COVID-19. It causes symptoms that are flu-like, including cough and fevers. There are many coronaviruses that infect humans, for example, ones that cause the common cold, but also ones that cause more severe disease like SARS, severe acute respiratory syndrome, and MERS, Middle East respiratory syndrome. All of these are coronaviruses, and the novel coronavirus belongs to the same family. I'm Dr. Maitreyi Shivkumar, and I'm a lecturer at De Montfort University. My background is in virology and immunology, and I've worked on lots of viruses including dengue, HIV, and also herpes simplex virus. The current virus was identified in Wuhan province in China in December 2019, and about a month later, the first case outside China was reported. Since then, it's spread to around 120 countries globally and is still an ongoing pandemic. We know that the virus originated from an animal source, and this is what we call zoonotic transmission, so a virus jumping from an animal to a human. The genome sequence of the novel coronavirus is very similar to a bat coronavirus, so we think that it originated from bats, but that hasn't been confirmed yet, and people are working on that to really try and figure this out. We now know that the virus can transmit between humans, and this is obviously something of concern because what we want to do now is to minimize transmission between humans. It spreads by close contact, so an infected person coming in close contact that is less than about 2 meters to an uninfected person, and can spread with respiratory droplets. So the reason it's critical now to minimize spread is because although about 80% of people who get infected by the virus will be able to clear infection with just mild symptoms, there are some group of people like the elderly, people with pre-existing conditions, so vulnerable people who will get more severe forms of the disease. The crucial thing that we're trying to do is what is called flattening the curve. And this is a process by which if we didn't have any interventions, we carried on with our life as normal, a lot of people would get infected and you would see a high number of cases at any one point. However, if we followed some of these procedures that will minimize spread of the virus, although the number of cases might remain the same, the peak is spread out, and so at any one point there will be lower number of cases, and that really helps the health services, the NHS, to cope with the number of people and to provide service in a meaningful way that allows them not to get overwhelmed. If we want to think about how similar it is to other viruses, the new coronavirus is similar to, as I said before, SARS and MERS coronaviruses. The mortality rate of the new coronavirus is lower than SARS or MERS, so the apparent mortality rate of the new coronavirus is at the moment 3.5%. But this number doesn't include people who are not showing symptoms or people who have mild symptoms. So it's likely that this number will be lower. As compared to SARS, the mortality rate was around 10% and MERS was even higher, around 30%. It is comparably causes less fatalities, but it does seem to be spreading much faster. If we compare it to flu, although this is not necessarily the best comparison because they are different viruses, the mortality rate of flu is around 0.1%, but this estimate does include cases where people have mild symptoms as well, which is not included in the estimates for the current coronavirus outbreak. The SARS coronavirus 2 is an RNA virus, and like all RNA viruses has an enzyme called RNA polymerase, which is involved in the replication of the viral genome. And this enzyme is quite error prone, which means that every time the virus replicates, mutations are introduced into the viral genome. In the current coronavirus outbreak, we are seeing mutations coming up as the virus spreads, But at this point, it's impossible to say whether this makes the virus more pathogenic or less pathogenic. Without testing, that is something that we cannot say at this time. One thing with the new coronavirus is that the mutation rate does seem to be lower. It's about 2 to 3 times lower than the mutation rate of flu. Because of the high mutation rate, we need a new flu vaccine every year, whereas it's likely that with the new coronavirus, once we have an effective vaccine, that will protect people for longer than just one season. Lots of people are working on trying to develop vaccines for coronaviruses, and there are some trials that are just starting out. Although I think it's likely that an effective vaccine will be developed a year and a half later, because in order to roll out an effective vaccine to the general public, it will take a little bit of time. So we're looking at around a year at least. In terms of therapeutics, lots of antiviral drugs which have been developed against other viruses like Ebola and HIV are being tested now against the new coronavirus, and there's clinical trials going on in the US and China, and it's more likely, I think, that we're going to get an antiviral treatment a lot sooner. So although this outbreak is spreading fast and it is a serious issue, it's important for people not to panic. What we want to do now is really minimize the spread of the virus to vulnerable people who might get severe disease. And it's really important now for people to self-isolate if they show symptoms, and also to prevent spread by hand washing and by not touching your face, trying to avoid large gatherings of people, which can involve close contact.
I'm Dr. Katie Laird from De Montfort University. I'm a reader in microbiology and head of the Infectious Disease Research Group. With the situation with coronavirus at the moment, the most important thing we can be doing is washing our hands as an infection control prevention. This is important for a number of reasons. When we wash our hands with soap and water, the soap breaks down the fats in the outer coat of the virus, and therefore it breaks it down. This is really important, and that's why everyone's recommending hand washing with soap and water. If you haven't got access to soap and water, using an alcohol gel or an alcohol hand wipe is the next most important thing that you can do. In terms of infection control and hand washing, it's been proven extensively, even on hospital wards before the coronavirus outbreak, that hand washing was one of the most important ways of protecting people against infection. To that end, we have developed a set of resources for children called a Germ's Journey, of which I'm co-founder alongside Sarah Uni, who is a specialist in education. And these resources are aimed at young children, because the concept of germs, the invisible germ as we call it, that those children can't see, and understanding why it's so important to wash their hands, particularly at this time, is really important. So Germ's Journey resources consists of a book, a picture book that young children from 3 to 5 can follow. We've also created and donated 3,000 books that are culturally relevant for India and Africa, because obviously their healthcare systems are not as well developed as ours, and it could save lives by having hand washing books out there. We've also designed online resources that can be downloaded globally. And these include posters of how to wash your hands, and also our superheroes. And these are being used in schools at the moment to try and help with hand washing and limiting the spread of coronavirus. The Germ's Journey resources as a whole are free at the point of access. They're relevant, they're interactive, we've got online games. We've worked with teachers both in the India, Africa and the UK, and developed resources that are relevant to them, which is really important if we want children and teachers to understand why hand washing is so important.